Did you know that your lifestyle might be secretly causing penile shrinkage? And what if I told you there's a way to reverse it and even enhance your size naturally? This isn't just about myths or quick fixes, it's real science that could change your life. But here's the catch. Most men don't even realize the mistakes they're making. Stick around, because what you're about to learn will completely shift your perspective. Causes of penile shrinkage? Number 1, decreased blood flow to the penile area. Decreased blood flow to the penile area can significantly impact penile health, leading to shrinkage over time. Blood flow plays a crucial role in maintaining the elasticity and functionality of penile tissues. When blood circulation is restricted, it can result in tissue atrophy, reduced size, and a diminished ability to achieve firm erections. Factors such as poor lifestyle habits, smoking, high cholesterol, obesity, and stress can contribute to reduced blood flow, further exacerbating the issue. In addition, conditions like diabetes, hypertension, and vascular diseases directly affect the blood vessels, making it difficult for blood to reach the penile region effectively. Over time, this can lead to a decrease in both length and girth, creating concerns for many men. The role of aging in penile shrinkage. Aging plays a significant role in penile shrinkage due to natural physiological changes in the body. As men age, testosterone levels gradually decline, which can lead to reduced elasticity and loss of penile tissue mass. Additionally, the buildup of fatty plaques in blood vessels, known as atherosclerosis, decreases blood flow to the penile area, further contributing to shrinkage and erectile issues. Another factor is the weakening of pelvic floor muscles, which impacts support and functionality. Over time, collagen and elastin fibers in the penile tissue become less flexible, leading to a subtle reduction in both length and girth. Belly size plays a crucial role in perceived and actual penile shrinkage. Excess abdominal fat, especially visceral fat, can partially engulf the base of the penis, making it appear shorter. This is often referred to as hidden penis. Additionally, obesity is linked to lower testosterone levels, which can contribute to reduced penile tissue elasticity and function. Increased belly size also leads to poor blood circulation, further affecting penile health and size over time. Moreover, insulin resistance is also the cause of belly fat. So the insulin resistance impacts penile health by reducing blood flow and contributing to vascular damage. It leads to poor circulation, tissue atrophy, and lower testosterone levels, all of which can cause penile shrinkage over time. How to reverse penile shrinkage? First, make healthy blood vessels. To make blood vessels healthy and boost nitric oxide levels, focus on diet, exercise, and lifestyle changes. Eat nitrate-rich foods like spinach, kale, beets, and arugula, which convert to nitric oxide in the body. Incorporate L-arginine and L-citrulline-rich foods like watermelon, nuts, and fish to enhance nitric oxide production. Exercise regularly, as physical activity improves blood flow and stimulates nitric oxide release. Stay hydrated to support circulation and maintain vascular health. Antioxidants from citrus fruits, berries, and dark chocolate protect nitric oxide from free radical damage. Avoid smoking and limit alcohol consumption, as these habits impair blood vessel function. Quality sleep is also crucial, as it promotes nitric oxide production and vascular repair. Adopting these practices ensures healthy blood vessels and optimal nitric oxide levels for improved circulation. The role of magnesium and vitamin C. Magnesium and vitamin C supplements can play a significant role in reversing penile shrinkage by improving blood flow and supporting tissue health. Magnesium helps relax blood vessels, enhancing circulation to the penile area, which is essential for maintaining penile size and function. It also supports testosterone production, which is crucial for penile health. Vitamin C, an antioxidant, protects nitric oxide from degradation and helps improve blood vessel function. It also supports collagen production, maintaining the elasticity and strength of penile tissues. Together, magnesium and vitamin C can enhance vascular health, boost testosterone levels, and promote better circulation, all of which contribute to reversing the effects of penile shrinkage. Regular supplementation, combined with a healthy lifestyle, can improve overall sexual health and prevent further shrinkage. Using a penis pump can be beneficial for patients who have undergone prostate removal, as it helps restore erectile function. Following prostate surgery, many men experience erectile dysfunction due to nerve damage or decreased blood flow. A penis pump works by creating a vacuum around the penis, drawing blood into the area and causing an erection. This device can improve penile health by increasing blood flow, which is essential for maintaining penile size and preventing tissue shrinkage. Regular use of the pump can help maintain the elasticity of the penile tissues, promote circulation, and support the recovery of erectile function post-surgery. While not a permanent solution, using a penis pump as part of a rehabilitation plan can significantly improve quality of life and sexual health after prostate removal. Jelqing is a penile exercise believed by some to help reverse penile shrinkage by increasing blood flow and promoting tissue expansion. The exercise involves applying gentle pressure to the base of the penis and gradually moving towards the tip, simulating a milking motion. This repetitive action is said to stretch the penile tissues, potentially increasing their size over time. Jelqing may help improve circulation, boost nitric oxide production, and maintain erectile health, especially in cases where shrinkage is due to poor blood flow. However, scientific evidence supporting its effectiveness is limited, and improper technique can cause injury. It's important to consult with a healthcare professional before starting jelqing to ensure safety, and determine whether it's suitable for individual cases of penile shrinkage. Testicular massage may help in reversing penile shrinkage by improving blood flow and promoting healthy hormone levels. The massage stimulates the testes, which are responsible for producing testosterone, a hormone essential for maintaining penile size and function. Increased blood circulation to the pelvic area can also enhance nitric oxide production, leading to better erectile function and tissue health. To perform testicular massage, gently cup the testicles with both hands and apply light pressure. Using your fingers, massage in circular motions for about 1 to 2 minutes on each side. Ensure the pressure is not too forceful to avoid discomfort. Perform the massage regularly for potential benefits. Testicles produce about 90% of testosterone in the body. Losing belly fat plays a key role in reversing penile shrinkage by improving blood circulation and reducing the appearance of a smaller penis. Excess abdominal fat, particularly around the waist, can hide the base of the penis, making it appear shorter. Reducing belly fat helps reveal more of the penis, giving it a fuller appearance. Additionally, belly fat contributes to hormonal imbalances, including lower testosterone levels, which can affect penile size and function. Losing weight through a healthy diet and exercise helps boost testosterone levels, enhance circulation, and improve erectile function. Overall, reducing belly fat not only prevents further penile shrinkage, but also supports better sexual health and function.